Hi guys, this is Dr. Simone Yuan here with bedtime stories, and just wanted to say a quick hello. I am so way past my bedtime. I've been up and I just couldn't fall asleep, so I thought I would just go on the different sickle cell groups and answer some medical questions until I got tired. But I remembered a question that I answered yesterday, I think it was, and I thought was something that probably everybody should know about. And so I decided I was going to make a short video about that and just pop it up in the group. I am still working on my YouTube channel and making the videos professional, and so please bear with me. I know I haven't put up anything for probably a week or so because of that. They are being made, they're just being edited, and so just give us some time and they should all pop up back. Right now I have addressed the issue of the opioid addiction and what to do, some things to consider doing in the wake of that, as it is targeting our population really, really hard. I can't wait for that to be up in the group. But anyway, the question that I answered had to do with someone wanting to come home and their hemoglobin seemed to be fine, and then seemed like the day they were going to be discharged, it was dropped a little bit. It went like from high sevens to an even 7.0, I think it was, and so the doctor wasn't comfortable sending her home with that hemoglobin, and so she was, but she was saying her pain was relatively controlled, and so she was kind of parked. And so a couple of things I wanted to make you guys aware of that, probably as a doctor, someone wouldn't think about, but as a patient, with the mindset of a doctor, I think about these things all the time. So one of the things is your blood work. And so, you're going in relatively anemic. They need lots of blood work done from the time you hit the ER. And so they're drawing bloods, coming back, drawing more. And every morning that you're admitted, you get a new panel of bloods drawn. And they're all drawn with regular size vials. I don't know why they never stop to think of the fact that you are already severely anemic, and every bit of your blood counts. So while the vials might look like a lot, and in the full scheme of things it's not a whole lot, for someone with sickle cell disease who might have critically low hemoglobins, every drop counts. And so especially if you're in for going on days, and they're doing that every day. So what I would encourage you to do is just gently prompt your doctor from the time you hit the ER to use pediatric size vials. They can use those, they can send those, and in the pediatric unit they don't take the same size vials, and they get the blood analyzed just as well. So they can use that even on the floor, and that will definitely save you a few drops of your blood. It's probably not as much as you're thinking that you're losing with vials, but if they're doing an extensive workup and you're pulling 6, 7, 8 vials of blood, or if you're doing this every morning and you're pulling quite a few vials of blood, it adds up, especially for someone who's critically low. And so that's one way of being able to save some of your blood. But another thing that I wanted to address is the fact that your blood will get diluted with the normal saline, with IV fluids. So it's kind of like, think about a cup of sugar. Let's say, it was a quarter cup of sugar, and then you put another quarter cup of water. It's going to be very sweet, right? But then if you put another half a cup of water and filled that cup, it wouldn't be as sweet. And that's because the sugar got diluted in all of that water. Well, something similar happens with your blood. So there is a resulting lowered hemoglobin, and it's just delusional. It's just because you have more fluid volume and still the same amount of cells. So they're now floating around in a bigger volume, and so when they look at it under a microscope, they'll be more spaced out, and they usually count per high power field. Like, so they'll look and see how many red blood cells are within a given area, and it's going to be spread out if there is more fluid that they're floating around in. And so it will look like your blood count is a little less. The other thing that can make that happen is if your nurse did not stop your IV for 3 to 5 minutes before drawing bloods, and you were having your IV run all night, and then they just turned it off and then went and just drew your blood and just didn't draw out enough of a waste sample. I've seen them do that. Then the result of your blood test is going to show an artificially lowered hemoglobin and making it seem as though you need a blood transfusion when you may not. And so one of the things that I do when I'm in the hospital is the night before I'm getting discharged, I actually have them stop the IV fluids, because I want to first of all see if I can support myself at home, or if I'm being artificially propped up by the IV fluids, and then I'm going to go home and crash. So I start drinking, taking my fluids orally, and they disconnect the IV fluids, and that way, by the next day they have, something that's pretty representative of what my blood would normally look like, closer to it anyway. And so then they can take a sample, and it will look a little bit closer to what the truth is. So I wanted to just pop that in here and let you guys just think about those things when you're in the hospital. These are not often the things that are in textbooks, but these are the things that we need to think about to make sure that we're doing well when we're in, and doing well as we transition out of the hospital as well. All right, hope you have a good night. I hope I get some sleep, and I will talk with you soon. You take good care. Bye-bye.